that all participants in the meeting mute their microphones unless they are invited to speak. Cameras should be switched on where possible, and I do realise that broadband signal in some parts may not allow this. All those wishing to speak should use the hands up function. Please speak slowly and clearly when invited to make a contribution, and that's also because it's being recorded. Could everyone please switch their mobile phones to silent? Participants, please refrain from using the chat or messenger function to conduct conversations. A reminder that the public section of the meeting will be recorded and later made available on the website for public viewing. And just to make you aware, item 8 is to be taken in private, so I will ask members at the beginning of the meeting if they agree to hearing this item in private. And I will advise that there will be a pause after item 7 and the recording will be stopped and the press will be asked to leave the meeting, and we'll then move into the private session. I will also be asking you to agree to take an urgent item of business under Standing Order 7.4, and that's a verbal report from Ian Gorman on primary care. So I'll also be asking for your agreement to that. And in the event there is a break in the meeting, the recording will be paused. Any questions about that?
No.
Excellent. Fiona, do you wish to begin the recording and then I'll read the introductory statement?
Fiona, the recording has started.
Thank you very much. Sorry, because I have the Word document open, I can't see the team screen. So welcome to this meeting of East Lothian Integration Joint Board on 17th of September 2020, which is being held remotely in accordance with the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention, and the webcast of this meeting will be publicly available for up to 6 months. Fiona, would you like to move now to a roll call of attendees, please?
Thank you, Chair. When I call out your name, if you could please indicate present. Susan Kempson.
Present.
Fiona O'Donnell.
Present.
Patricia Donald.
Present.
Fiona Ireland.
Present.
Peter Murray.
Present.
Richard Williams. Okay. And I have apologies from Councillor Shameen Akhtar and Councillor Neil Gilbert, who have both nominated substitutes. So could I ask Councillor Paul McLennan?
Yeah, present.
Thank you. And Councillor John McMillan? Councillor McMillan? Okay. And now we move to the non-voting members. And I have apologies from David Binney, Gaurav Chowdhury, Philip Connoglan, Lorraine Cowan.
Present.
Thank you. Richard Fairclough, Claire Flanagan.
Present.
Ian Gorman.
Present.
And I think we have apologies from Alison MacDonald.
Correct.
Marilyn McNeil. Okay. Thomas Miller.
Present.
John Turville.
Present.
Leslie White. Paul White. Paul White?
Sorry, present.
Thank you. And we also have officers present from the Council and NHS Lothian and Audit Scotland today. These are Duncan Stainbank, Paul Curry, Jane Ogden-Smith, Claire Goodwin, Laura Kerr, Esther Schoberg and Emma Simon. And could I ask officers when they first speak, could they introduce themselves please, just for the recording? Thank you. And can I lastly ask if any members have any declarations of interest to make on any item?
Chair, Councillor John McMillan here. I was in at the beginning of the meeting and somehow was disconnected, but I am back in. So just for the roll call, can I declare my presence?
Thank you, John.
I've got one possible declaration, Fiona. Under the new directions, I've got a question about the way forward for housing by, and the interest I have is it in my day job for organisations supports people with learning disabilities.
Okay. And do you think that that interest is sufficient for you to remain in the discussion, or would you rather remove yourself from the discussion?
I think I'd be comfortable to remain if our chair and colleagues think that's appropriate. The question is really from the perspective of folk with learning disabilities rather than my organisation.
Okay, that's great. Thank you very much. If the chair's agreeable, then I think that should be fine. Thank you.
I agree.
And then I think there are two items that the chair wanted to cover, item 8 and also the urgent item.
Yes, so are members happy to agree we resolve to take item 8 in private and that we take an urgent item of business at the end of the public part of the meeting?
Yes, agreed.
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 Excellent. Thank you very much. We will now proceed to the business in hand today. So in terms of the chair's report, I'm going to keep my comments very brief because we have a busy agenda. But I do want in particular to welcome Councillors McLennan and McMillan to the meeting today. You're very welcome and we look forward to your input. I do want as well to put on record just our thanks as an IJB to all the staff that work in our health and social care services across East Lothian and in other parts of Lothian which serve our population, to thank patients and service users for their patience and compliance during this very difficult time. And particularly, I think, to send our thoughts and wishes to those with caring responsibilities, because this has been an incredibly difficult time. And I'm glad that during this meeting today, we'll see the concern expressed at various points in the meeting, but also the actions to be taken to try and ease some of the responsibilities, the extra responsibilities which carers have faced. So without any further ado, I'm going to move on. So Fiona, would you like to introduce the next item of business, please?
Thank you, Chair. Item 2 is the 2019-20 audited annual accounts.
Thank you, everybody. It's Claire Flanagan. I'm the Chief Finance Officer for the IJB, and I will be presenting today the audited annual accounts of the IJB for 2019-20. The accounts were presented in draft in June during the emergency recess arrangements of the IJB, and these accounts were also presented at the IJB's Audit and Risk Committee, so the virtual meeting held on Tuesday of this week, the 15th of September 2020, and were, I'm pleased to say, recommended by the committee for approval here today. The accounts have now been audited, and Esther and Emma, our external auditors, from Audit Scotland, are here with us today, and they will present the external audit report to us at the next agenda item. I'll just talk you through the main points of the document. So the accounts focus on the management commentary, which is the telling the story of the IJB during 2019-20. And from page 5 onwards in your pack, it lays out the role and remit of the IJB, presenting the members of the board as at March 2020, and the attendance of members during the year. It refers to the change in personnel of the board where replacements or additional appointments were made. The management commentary provides a summary of the operations of the IJB during the year and does reference the COVID pandemic and the impact this has had on the IJB, for example, with some of the publications being delayed in line with national guidance. We highlight the opening during the year of the new community hospital in Haddington and the benefits this will bring and provide East Lothian. The award won for the Wellwind Hub in Trinent. So the hub features smart technology to assist people requiring technology to help with daily tasks, such as reminders for turning on lights with voice commands, and provides an element of training and awareness sessions for staff to support staff in finding effective solutions to assisting clients with their day-to-day activities. The work within the community justice, so the self-evaluation was carried out during the year. The evaluation consisted of several months of evidence gathering, followed by a comprehensive review and assessment of services offered against standards of each quality indicator, and was well received by the Care Inspectorate, who noted a strong commitment to collaborative working within East Lothian. The expansion of our quick service, so the collaborative working for immediate care service during 2019-20, and in doing so has further directed appropriate activity from GPs, which is one of the desired outcomes from the new GMS contract, or the General Medical Services contract. We detail plans for the future, but we also recognise that COVID has brought challenges in delivering of our services. We then go on to summarise the year-end position, which resulted in a surplus for the IJB of £626,000. It's worth noting that all the statements throughout the document are presented on a net basis. We then provide the financial year-end position by service area and provide an overview of the drivers of the financial position by direct and pan-Lothian services. This does highlight our main financial challenge sits within the learning disability social care budgets and the set-aside budgets, so the set-aside delegated functions of the IJB. Due to ending the year with a surplus, the IJB has increased its reserve in 1920, and a summary of the reserve is shared, and the balance is sitting now at just under 2.4 million across both general reserves and earmarked reserves. We explain the IJB's agreed strategy and the business model underpinning this, and we finish with the risks and uncertainties, again making reference to the uncertainty and change the COVID pandemic has and will continue to have. We then move on to the statement of responsibilities, so page 22 and 23 in the pack, whereby both myself as Chief Finance Officer and Fiona as Chair will sign these off. And then on to the remuneration report from page 24. Again, we'll follow the same principles as in previous years, so whereby the IJB doesn't directly employ staff, it's only the Chief Officer and Chief Finance Officer who are shown as part of this remuneration report. And it also splits the remuneration between their role on the IJB and their operational roles within the partnership. The annual governance statement, which I'm not going to go through in detail, but it's worth pointing out that the IJB's Chief Internal Auditor in his report shows reasonable assurance with the overall adequacy and provides us with some actions in scope for improvement in future. This was presented alongside our draft accounts back in June at the virtual meeting held under the emergency recess arrangements, and it was also presented at the Audit and Risk Committee on Tuesday of this week. The accounts now include the independent auditor's statement based on the report that Esther and Emma will share with us at the next agenda item. And then the document moves on to provide the accounting statements. So we have from page 34 onwards in your pack, the comprehensive income and expenditure statement, which highlights our £626,000 of a surplus for 1920. The movement in reserve statement, which shows the closing reserve balance of 2.398 million, and the IJB's balance sheet highlighting our total assets, which is our reserve, both general and earmarked, which is held on our behalf by both partners in their financial ledgers. The statements are then supplemented with notes to the accounts, and as mentioned earlier, the accounts were presented at the IJB Audit and Risk Committee on Tuesday of this week, so the 15th of September, and were recommended to the IJB for approval. Once approved this year, they will be signed off electronically and published as usual, and I'm happy to take any questions.
Thank you very much for that report, Claire. And I think an excellent example of how to give a report from an officer that adds value to the papers, and maybe just to send that little message to others speaking today that we will have read the papers before us. So just what adds value or anything you feel you want to draw out, but keeping comments brief is very welcome. I've already had an opportunity at Audit and Risk to ask a large number of questions around the report. I did just want to ask one thing before I open this up to other members, Claire, and that is around the reserves. I wouldn't want anyone thinking that here in East Lothian we're struggling to find money, things to spend our budget on, but we've had guidance from Scottish Government in terms of the level of reserve that we should aim to hold as an IJB. So have we reached that level yet?
No, so because the IJB is set up under local authority regulations, the IJB is required to aim to have a general reserve, and the general reserve that we have aim to achieve is 2% of our net expenditure. So the IJB does have its own reserves policy, and that is a policy that's been signed off at the IJB in previous years. And no, we're not yet at that limit. Our general reserve, if it was 2% of our net expenditure, you're looking at about £3 million or thereabouts, and we're at 1.7 of general reserves. So still a bit of it.
Thank you very much. I'll now move to Councillor McMillan and then Peter Murray.
Thank you, Chair. A couple of questions, if I may. One around the governance statement, and it's really just around, I know that a very small part of this year would have been under the emergency arrangements and lockdown, and I wondered how that had affected and is affecting in this financial year the governance arrangements, and whether Claire would like to say something about that. And it may be a question I know that the auditors will touch on, and I know that we're looking backwards. And my other question was just in terms of audit and governance yesterday. You've already mentioned, Chair, that you personally had asked a number of questions. I had a bit of feedback from a member who had attended that quite a few compliments had been paid about the way that particularly best value was being achieved. But I wondered if there was any highlight from audit and governance, given that it was, I understand, only yesterday, that you'd like to report back to the full committee on. Thank you.
So do you want me if I answer them in terms of the governance arrangements? And I'm conscious this is the annual governance statement is Duncan's statement. He's on the call, so he can come in if he's looking for it. But the IJB did put itself into emergency recess arrangements, and during that time, decision making was delegated to the chief officer in conjunction with the chair and the vice chair. So those meetings were scheduled and those routine catch-ups were carried out. So, for example, our IJB budget offer didn't come through in our normal window of normal business. So we had a virtual meeting like this with myself presenting the paper to the chair, the vice chair, and the chief officer in terms of the budget offer and the proposal to accept that budget offer from both council and NHS Lothian, and to take forward the business in a virtual manner. And that's really what we've done all throughout the emergency recess, and just recently came back into operating business meetings in this virtual capacity.
Claire, I'll just echo what Councillor O'Donnell said about the clarity that you've given us, and those are exactly the kind of areas that it's good to hear about, and I'm sure that the IJB is in safe hands. So thank you.
Thank you, John. And I think it, also worth mentioning that through this period, absolutely understandably, that there were communications from Scottish Government which had to be enacted very quickly to keep people safe, to try and control the virus. And as an IJB, we're aware that from time to time that officers may be, have to follow instruction from Command Central. Duncan, do you want to add any comment at all at this stage before I bring in Peter?
All I would say, I would echo Claire's comments and say that I don't think there was a significant impact, certainly on things leading up to the 31st of March 2020, but we do have a governance review on the internal audit plan for 2021, which we haven't commenced yet, but that should provide further assurance to the members that we're completing that.
And Esther, sorry, one moment. And Esther, can I just check, do you wish to come in just now also on the issue of governance?
Hi, Councillor O'Donnell. It's Esther Scoberg, the Senior Audit Manager here for Audit Scotland, just speaking for the first time. Just to say for Councillor McMillan, we will be looking at the governance statement for 2021 in line with the normal audit procedures as we do every year. And I'm sure there'll be flags coming centrally, which will be national, to look out for in governance statements in light of COVID. So just to reassure you, we will be doing that as part of the 2021 audit of the IJB. That's all.
Thank you, Esther. Did you have a supplementary, John?
No, I just wanted to thank Duncan and to wish him well in his new substantive appointment, which I read about yesterday. So thank you, Chair. Thank you, Duncan. Thank you, Esther.
Lovely. Can I ask you to put your hand down now? And just for, I know it's really difficult. I did it in audit and governance, audit and risk. It's very difficult to remember all these different functions now. Peter Murray now, would you like to ask your question, Peter?
Thank you, Chair. And Claire, thanks very much for a very clear report. It's obvious that there's a lot of work going into this and it's reflected in how easy it was to read and understand. So thanks very much for that. My question is on page 29, the action plan. Obviously, I would align myself to all of those. I think they are sensible recommendations. And my question relates to when do we see them return and where would we expect to see them be progressed?
So in terms of the actions that come out of the internal audit reports, and then also the actions that come out of our external audit review, we do collate those actions and monitor them routinely, as we do with, for example, the risk register. And our plan would be to report them back through audit and risk. So at audit and risk on Tuesday, it was meant to be, it was a bit late, but it was meant to be at the June meeting, but obviously that didn't take place. So on Tuesday, I gave at audit and risk an update on the audit actions from 2018-19. It's also worth saying that Duncan and his team do what we call audit follow-up work. So in terms of all the audit actions that and all the internal audit actions that happen throughout the year, they follow them up routinely with officers through normal business.
Can I come back to you?
Yes, certainly.
Yeah, thanks very much, Claire. I just wonder whether or not those ones in particular lend themselves to more to an IJB interest, such as the sort of breadth of activities that they're going to cover, in particular the last one. So I was going to ask a question on the next part of the audit, but I'll position it now. And obviously the third bullet point refers to the arrangements in place for projecting social care expenditure growth in the later years. And that's something that I think we should be particularly interested in and discussing at the IJB. So I suppose my suggestion is that, Chair, perhaps we can consider whether or not these actions could form part of the monitoring of the IJB itself, as opposed to going through audit risks such as the breadth of activities that they cover.
So I suppose just to come back on that, Peter, that third bullet point was actually an output from an internal audit. So Duncan and his team carried out an internal audit review of our financial planning at the start. We done it virtually. It's the first audit we've done virtually, so we done it at the start of lockdown. So between April and May time, and that audit report was actually taken to audit and risk on Tuesday as well, where there was a full discussion on the audit and the outcomes. And I suppose that's something that the IJB would like to see the updates from that brought through from audit and risk to the IJB. We could look at that, but it is considered in quite a lot of detail at our audit and risk committee.
I think, Peter, in the broader sense, given the scale of the financial challenges which this report highlights and the possible impact on commissioning of services, on directions, I think that there is a role for the IJB as we go forward. Are you happy with that response, Peter?
Yes, thanks very much, Chair. I am.
Thank you. Okay. Are there any comments which any members wish to make? No, I see no hands going up. Can I just thank you, Claire, for all your efforts and having it ready for today as well, despite all the other pressures that you've been under, but also that this report isn't just a balance sheet. It really shows the quality, the innovative nature of the work going on in East Lothian. And I think that's something that every member of this IJB, everyone who works in health and social care services in East Lothian, can be justifiably proud of. Now, in terms of the process at this stage, can I first of all ask members, with the exception of recommendation 2.1 II, if you are happy to agree those, because those are just for noting, and we will then move to a roll call vote on the recommendation I've just mentioned. Members happy to agree? The others for noting?
Agree. Agree.
Thank you very much. Fiona, would you like to progress to a roll call, please?
Yes, thank you, Chair. For recommendation 2.1 II, which is approval of the accounts and for formal sign-off, I'll call each individual voting member's name, including the substitutes who are here today. And if you could indicate, please, whether you agree to approve this recommendation or not. Fiona O'Donnell.
Agree.
John McMillan.
Agree.
Paul McLennan.
Agree.
Thank you. Susan Kempson.
Agree.
Thank you. Patricia Donald.
Agree.
Fiona Ireland.
Agree.
Thank you. And Peter Murray.
Agree.
That's unanimous agreement of the second recommendation. Thank you.
Fiona, I think you're still on mute.
We can move on now to item 3, I believe, independent auditor's review of the annual accounts.
Hi, thank you, everyone. My name's Esther Skoberg. I'm the External Senior Audit Manager for Audit Scotland, and I'll be presenting item 3A to you. I'd just like to first send the apologies from Gillian Woolman, who's the appointed auditor and who will be signing the accounts following this meeting. She was unable to attend, and she is quite disappointed because she wants to engage with members. So I just wanted to get that out there. At the end of the meeting, I'll go over with those members and officers who are signing very briefly on the electronic signing process we're using this year, which is DocuSign. So I hope that's okay. It will be fine, I promise. If I can take you now, I'd first like to thank Alison McDonald and Claire Flanagan in the IJB for all the help to complete the audit in a timely manner, and given all the lockdown challenges, working from home and technology challenges we all face. So I'd just like to have our thanks recorded there. If I can take you to item 3A on page 45 of your pack, this is our ISA 260 letter, or our report to those charged with governance, as we presented to the IJB Audit and Risk Committee on the 15th of September. It sets out a summary of our audit and, what I'd like to say, our unqualified audit opinion on the 1920 accounts. The draft audit opinion is included at Appendix A of that paper, which is also included in the accounts that you have just had presented to you by the Chief Financial Officer. Page 49, Appendix B of the same paper, is the ISA 580, which is a letter of representation, which sets out management's key assurances for us. And this will be signed by the Chief Financial Officer following this meeting once we sign the accounts. So I'm happy to take any questions on this paper, or just lead you to item 3B, which I'd hand over to Emma Simon, who is the lead auditor for the IJB.
I think if we just carry on with Emma, and that will give members time to reflect on the question. Thank you, Esther.
Super, thanks.
Thank you, Esther, and thank you, Chair. I'm Emma Simon, Lead Auditor from Audit Scotland, and I'm pleased to present you the 2019-20 East Lothian Integration Joint Board's Annual Audit Report. We've discussed and agreed the contents of this report with the Chief Finance Officer and would like to thank all involved for their help and cooperation throughout the audit process. Turning to the report, the key messages are shown on page 56 of your meeting papers pack. This section sets out the messages which are important for all members to be aware of and captures the high-level conclusions of the East Lothian IJB audit. Section 1 of the report on page 60 includes a reiteration of the main judgments in the independent auditor's report. It then goes on to highlight the quality of the accounts that were submitted to audit, and we note that we have no issues or misstatements to report. In paragraph 22, we provide an update on the implementation of the 3 prior year recommendations and are pleased to report that good progress has been made and all have been addressed. Part 2 of the report starts on page 62 and acknowledges that financial plans are closely monitored and indeed that the year ended with an underspend position. Although the COVID-19 outbreak had minimal impact to the 1920 financial year, it has since had a significant impact to the IJB and brings significant implications for financial planning going forward. Service disruption is anticipated to continue and the financial implications of this remain uncertain. In relation to the pandemic, the IJB has been actively monitoring and reporting on their medium and long-term financial position and should continue to do so. Within section 3 of our report on page 65, you will find our assurances over the governance arrangements that you have in place and our judgment that amendments to these in light of the pandemic have been appropriate. We also provide comment on your arrangements for monitoring and reporting performance and for securing best value. We conclude the section with reference to our national performance reports, details of which are included at Appendix 2 for further reference. And finally, Appendix 1 provides assurance of our audit approach in relation to the risks that we identified during the planning stages of the audit. I would like to conclude by emphasising that we have no recommendations to make from the 1920 audit and reiterate my thanks to the Chief Finance Officer and team for their cooperation during the year. We will continue to work closely with officers in the coming year as the IJB adapts to the significant challenges of the pandemic. Myself and Esther are now happy to take any questions.
Thank you, Emma. Thank you, Esther, for your report and your verbal contribution today, which gives a very high level of reassurance to the IJB. Peter Murray, you have your hand up. Would you like to ask your question?
It's more a comment, Chair, if I can. I'm just building on what I said earlier. We'll be more specific this time. Page 68, item 3, financial sustainability. Obviously, there's a figure there of 17.7 million of a potential gap. And I think it would be really helpful if we could be provided at some point as the IJB with some scenario planning as to how we might bridge that gap, as is suggested in the commentary, where a medium-term recovery plan is indicated as the necessary response to that. And it would be, I think it would be really reassuring if the IJB could start to see where that planning is taking place and what impact it's going to have on the communities, if any.
I think that's a really good comment and question, Peter, because I think as well in terms of the IJB in its communication with its partners in terms of their funding officers, but also in terms of decisions that are taken in other places for us to be able to lobby to protect services here in East Lothian. And that's not in any way said with a party political hat on. Who would like to respond? Esther, Emma, or both? Or Claire? Claire, you have your hand up. Thank you.
Yeah, just on that, Peter, we're in the process of updating our 5-year rolling financial plan. So the values that are in the report are from our June 2019 approved 5-year rolling financial plan. It was planned to be brought to either the June meeting or this meeting this financial year, but given the COVID uncertainty and more recently the remobilisation process, it's been delayed, but it is on our radar and it is under work in progress.
Can I maybe just clarify if that figure for the shortfall for 23-24, does that include the COVID-related expenditure?
No, so that financial plan was approved in June 2019 before. So that was really just us projecting using the Scottish Government's medium-term financial framework for health and social care. That is we used that as to support us developing the financial plan back last year, and that was our year five position.
Esther.
Hi, yes, thank you, Chair. Just to clarify, so Appendix 1 that is cited with page 68, that says this was from our annual planning, our annual audit plan, which was prepared very early at the start of the year, pre-COVID and things. So our responsibility is to report on those risks and show that they were cleared and in good time before COVID. 2021 will be challenging and beyond, and we will be looking at that again under the microscope, I suspect, even more so going forward with all the challenges. So it will be looked at further, and we will have comment again. It'll feature as a risk going forward in the plan next year for all IJBs, not just this one.
Thank you. So I just think, for someone listening to this and perhaps not with the papers in front of them, I'm sure there will be further money coming to help us out with COVID-related costs. But when that money comes through, they don't think, oh, the funding shortfall is gone. They're fine in East Lothian now. So just to be clear about that remaining challenge. And I think going forward today, when we look at the transformational work that's going on, the emphasis on best value and outcomes, why this work is so important to make sure that every pound spent by this, by the Health and Social Care Partnership, it results in good outcomes for people in East Lothian. Esther, did you want to come in?
Sorry, it was just since you mentioned best value and on the back of Councillor McMillan's question earlier about best value, and we did have, we did look at the performance report that was submitted, and it had changes in it from the prior year. We felt it was very good at reporting, and I hope we've managed to capture what we found, the positive aspects of what we found on page 66 of the annual audit report, and we will revisit best value. Things will have to change in light of the pandemic and how the IJB will address certain things. There'll be new measures they need to put in place now, clearly just as a result of how things are having to operate. So all that will be looked at going forward with next year's audit and beyond.
Thank you very much for that, Esther. Are there any other comments or questions that any members want to make at this stage? Councillor McMillan, John.
Thank you, Chair. Can I just take this opportunity to comment on what I think is a very strong and constructive relationship between the IJB account staff and the auditors. It comes across as something very positive and collaborative, and I think that's reassuring for anybody thinking about governance. May I also just take a moment to thank Esther for bringing up that point about best value, because in the last report, Claire very clearly commented on the new community hospital, and I'd like to pay tribute to the project staff who I think may well find themselves in their very last few days of completion. I think it is a building that will help the health service and the integrated joint board provide services better, quicker, and hopefully as effectively and as cheaper. And also to mention the Wellwind Hub. In another part of my duties, I was lucky to be at the SIPFA Awards and to note at the Star Awards and other external recognition, all of their work being recognised and rewarded in many ways during the last year. So on that note of best value, I think that was a very fine example of your work, and as an external observer today, I'm happy to comment on that. So thank you for that opportunity to comment. Thank you.
Thank you very much, Sean, for those comments. And of course, as an integration joint board, collaborative working is in our DNA. So if there are no further comments, can I ask, we don't need a roll call vote, these are just recommendations for noting. So are members happy to agree the recommendations?
Agree.
Agreed.
Agreed.
Very much. Thank you, Emma and Esther, for your contributions. Fiona, next item, please.
Item 4 is the financial update for 2020-21.
Thank you, Fiona. So it'll be myself again presenting this paper, and I'll just talk you quickly through the main points within the report. So this finance update provides the board with the IJB's year-to-date position and the outputs from the recent financial forecasts carried out by both our partners through their Q1 financial review process. Given the current COVID pandemic, the financial position is not straightforward. It's not straightforward to understand, and it's not straightforward to report, and the finance teams within both partners continue their work to determine the financial position in terms of what is the position for our core operational business, what is the impact of COVID-19 on the position, and what is the mobilisation and the remobilisation impact of our position, and the extent to which these costs will be covered by Scottish Government. The East Lothian IJB's year-to-date position as at the end of June 2020 was, I'm sure you can imagine, was an overspend. So it was an overspend of £1.1 million, and the forecasted year-end position as a result of the Q1 financial reviews carried out by both partners is a projected overspend of £2.8 million across all the IJB's delegated functions. The IJB to date has received funding from Scottish Government, so East Lothian has their share of the Scottish Government funding that's been released to date, so that's 75 million nationally, and that's 1.4 million for East Lothian. This has not been factored into the position at this time, given the requirement of the partnership to support our external providers through the financial sustainability principles developed by COSLA and Scottish Government. Given the uptake and the value surrounding that support is quite unknown, it was felt that so early on in the financial year we would retain that 1.4 million, assess the impact of these sustainability payments, and then assess where we would like to move that funding to cover the COVID costs. The forecast of 2.8 million is broken down in figures 1 and figures 2. So the core services within their partnership are 2.1 projected overspend, are hosted services, so that's services that are delegated to IJB but operationally managed by another part of NHS Lothian. For example, the Royal Ed campus in Edinburgh that supports mental health and learning disabilities inpatient beds. The hosted services are projected an overspend of £236,000. And finally, the set-aside budgets projecting an overspend of £891,000 this financial year. So the set-aside budgets being the budgets held on behalf of the IJB in the acute hospital environment. So, for example, accident and emergency. The social care budget at Q1 was projecting actually a £397,000 underspend, but it is worth noting we anticipate this deteriorating into an overspend position at the Q2 financial forecast. So we're anticipating that this forecast of 2.8 million will get significantly worse. The position will continue to be monitored to get a better understanding of all the different elements impacting this position. But there was, at the time of writing this report, a significant COVID-related costs in the first few months of the financial year, and I put them in italics in figure 2. So these are the COVID costs that we have managed to track across all elements of the IJB in the first 3 months, and they were estimated to be across all the health budgets 1.8 million of COVID-related costs, and across our social care budget 1.2 million of COVID-related costs. It's worth saying we track the COVID costs, the COVID impacts, mobilisation costs and remobilisation costs very closely, and we report into Scottish Government into all the necessary reporting arrangements that they have in place. These projections will be refined at Q2 and will be reported again back to the IJB. And in previous years, this is picking up Peter's point around our financial plan earlier. In previous years, the IJB has produced a longer-term financial plan. Work had started on this, but given the complexity regarding COVID and remobilisation now, this update has been delayed and will be reported back to the IJB at a future meeting. And the final part of the finance report is an update on the East Lothian HSCP's remobilisation developments. So the remobilisation plan is coordinated via NHS Lothian, and the Health and Social Care Partnership feeds into this process. But it's worth pointing out to the IJB that there are 2 elements being actively undertaken to support system-wide remobilisation. The two main elements being the expansion of East Lothian Care Home Support Team and the enhancement of community teams supporting rehabilitation. Both Leslie and Lorraine, I hope, are on the call today. So if anyone has any questions surrounding these elements of remobilisation, I'm sure they'll be able to answer those questions. And we'll bring back further updates on remobilisation to the board at a future meeting. And I'm happy to take any questions.
Thank you very much for that, Claire. And I don't know if this will maybe be one for Lorraine or Ian or someone else, but I'm just wondering about the impact of the backlog now, which NHS Lothian faces in terms of scheduled care, seeing operations, things like hip replacements. If there's been any assessment done of the likely impact of delays in providing that care and those services to patients in East Lothian on our budget.
So I'm not that close to the scheduled care activity, but I see Fiona, luckily Fiona Ireland, the NHS Lothian is on the call, so it might be Fiona's got something more detailed to comment.
Okay, Fiona, I'll bring you in, but I think we should note first that no meeting of East Lothian IJB is quoted with at least 3 people called Fiona being in the meeting. So Fiona Ireland.
Your mic's off, Fiona.
Sorry, I don't have an update on the scheduled care. I mean, it is we are remobilising certain elements and certain numbers, but there's some strict work around pathways and the numbers of patients that we can bring in, and the fact that people have to have shielded prior to and the progress pathways through the hospital service. So I'm probably not the best person to answer that, and Ian might be able to give you a better insight to that, but we certainly are remobilising. What I actually wanted to comment on were a couple of things. Absolutely supporting the expansion of the care home team, and just for the record to add that East Lothian has been in a very good position to support the care homes throughout COVID, because we already had an established team, and building on that is really welcomed, particularly as we progress through year into winter. And the community team enhancement for rehabilitation, another area where I think we're ahead of the curve, and I think that's well worth just docking with the IJB. The one area I did have a question about, and I don't know whether Claire is able to answer, is around the overspend in the set aside of 891,000. To what extent does the IJB understand or have an understanding of why that's occurred? Because during COVID, the number of attendances at ED dropped significantly, and one wouldn't expect an ED overspend as a consequence.
Yes, Fiona, one of the biggest pressures that sits within our set aside budget is actually the junior medical staffing budget. So that's a pressure across the whole of Lothian, and obviously the IJB through the set aside model takes their share of the junior medical budget. So that makes up about just under $500,000 of that's just over half of that 891 projected overspend is junior medical staffing costs.
And just as supplementary, I'm aware, Councillor McLean and Paul, you're waiting to come in, and Paul White. Just in terms of how that budget works, so if staff in ED were redeployed to other services, would that then come out of the ED budget?
So I would probably need to go back and just double check the mechanics as to what's happened there. But I don't think they would have done that level of transactions and moving around budgets within the NHS Lothian ledger, because that would have been quite a mammoth exercise. But I can go back and double check.
And I can understand if the priority is to get people into ICU to support patients. Paul McLennan, we've got 2 Pauls, not quite as many Fionas. Paul McLennan, would you like to come in?
Yeah, thanks, Fiona. And first meeting, so thanks for
let me come in. A question around about scenario planning around about COVID. Obviously, we've looked at that. What scenario planning do we have in place? And it's on the background of looking at increasing numbers and talks of national lockdowns and more restrictions and so on. So what scenario planning do we have in place? Is there a worst case scenario, or what are we basing our figures on? And what kind of scenario, if we go down in a 3-month lockdown or whatever, what are we basing these figures on in case there is? Because again, there's a lot of fluctuation, but it'd be good to know what the scenario planning is based on these figures. Are we discounting a second wave? Or are we making sure that's in for 3-4 months? Or what are we basing our scenario planning on?
Yeah, so we continue this Q1 forecast specifically on the health side was done quite early on, so it was done just at the end of June, and it's worth pointing out that it has been refined twice since we drafted this report. But at the moment, the assumption is we are basing it on the COVID-related costs and the things that we know we have enacted through our mobilisation plan, and then also what we have enacted and are planning to enact through the remobilisation plan. Yeah. But it doesn't yet scenario model out impacts of second waves or other lockdowns. That is not what we've not built that anything like that into these numbers at the moment. What we tend to do is we get a lot of direction and guidance from Scottish Government in terms of how we should be reporting and what we should be reporting and assumptions we should be making as part of this. And I suppose just so it's just based on what we know we have physically enacted at this point in time.
Right, Fiona, can I ask a supplementary if it's okay? And it's probably part of what Audit Scotland as well. You know, as we go ahead, it's looking more and more likely there are going to be further restrictions and there's impact, and hospitalisations in other parts of Europe are beginning to ramp up already. So I suppose it's kind of thinking, right, if we come to the next meeting, how agile can we be, for example, if we know there are going to be additional costs, and that end year figure then begins to increase. So it's how flexible are we, and when do we then build in that scenario? And I know you're saying, Claire, that's part of that is then coming back to what Scottish Government are saying and what comes out of Scottish Government. But at some stage we should be looking to see, right, when do we scenario plan for something else happening in terms of further restrictions or more hospitalisations. Yeah. It just seems to be a little bit hit and hope, and that's not having a go at yourself, because obviously that's the guidelines, and that's maybe something we need to feed back to Scottish Government, is as soon as we get some direction, that these figures should be adapted, and I think it's highly unlikely we'll go through the winter without further restrictions or further hospitalisations. Hopefully that would be the case, but I can't see it. So I don't know if it's through yourself or maybe through Audit Scotland as well, about what's the kind of, how do we then build in, and how agile can we be if the situation changes, as it can very quickly?
Can I maybe, first of all, I was just thinking Ian Gorman to come in, because certainly in terms of capacity and Paul, there's capacity that is there ready to go. I was going to use the word oven ready, but I think I'll ditch that one. So if I maybe bring in Ian at this stage, and then Claire, if there's more that you want to add, or Audit Scotland.
Thank you, Fiona. So in terms of, as you describe, oven bake capacity, we have a level of agility within the service to respond to increases demand as they start to arise. Now, what we're likely to experience based on current guesses is small pockets of local lockdowns rather than necessarily what we saw in the first wave. And I think and be careful how I word this, but I think the assumption is that we won't have the same significant peaks in demand on acute services, and so we won't have the same significant challenges to face that we did right at the start in terms of mobilising services to respond to COVID at the pace we had to respond. So we have a flexibility within our operational plans to develop. Having said that, and Claire can come in this as well, I think where we need to, in response to an urgent necessity, put something into operation, we would do so in partnership with NHS Lothian and the other partnerships very, very closely, and with East Lothian Council. And within that, take a note and understand the financial risk we were incurring in mobilising those resources. And that is what happened in March and April of this year. So I think in terms of would be exceptionally challenging to sit today and maybe a difficult, an almost futile exercise and map out the different operational responses and financial risks that those would incur based on current COVID modelling. But I would have a fairly strong level of reassurance that if we did get ourselves into a position where we needed to make operational decisions which had a significant financial risk, that we would, as we have been doing, code those financial risks separately and look for support across the partnerships to deliver them.
Thanks.
Thank you very much. And I think as well, looking, Paul, you know, my concern as well would be resilience teams and communities having stood down that how flexible we can be, given that people will possibly still be working before they were able to contribute. So I suppose it's working as well with our partners in the council and the NHS. And Claire, is there anything more you want to add in terms of financial modelling and flexibility?
Yeah, I suppose just to reiterate Ian's point, we do work really closely with finance within East Lothian Council and finance within the Health Board to ensure that we understand what's driving the costs and the likely projection, the impact and the projections they might have throughout this financial year and potentially even longer term into this might be our new business as usual. So we're continuing to refine that, and I suppose we've got another NHS Lothian and the HSCPs feed into that. So there's another return due this Friday, the 18th, going back to the Scottish Government regarding COVID-related costs that are across all the Lothian HSCPs and NHS Lothian as a health board. It's just worth maybe noting that as much as we've had some financial support from Scottish Government to support social care, NHS Lothian have not yet had any funding released to support their position. So this return tomorrow is it hopefully will start supporting the flow of funding flowing through from Scottish Government into these operational budgets.
Thank
Thanks.
you.
Thank
I'll
you.
just bring Ian Gorman back in, and then Paul, if you're also wanting to comment in relation to this, that's Paul. Harry, I'm aware that I've got Tricia waiting to ask a question. We'll just finish off this item if that's all right. Tricia and Paul White, if you're wishing to come in, by all means do put your hand up again. I hope you haven't been put off asking your question. Ian.
Apologies, it was just to add an extra item on the care home team expansion and the additional rehabilitation supports, and to say that those, in fairness, are modelled on the impact that we currently understand that those who've come through hospitalisation due to COVID are going to need long term. So we're modelling those out as effectively expansions of care provision that are just needed as a result of the pandemic's first wave, and only likely to be enhanced if we continue to see enhanced hospitalisation over the coming years. So it was just to flag those two, which is why we feel strongly that those are part of the remobilisation of services under the COVID remobilisation plan, rather than just additionality.
Thank you very much, Ian. Paul Curry, did you want to add anything in relation to
yes,
this?
Yes, just to say that in response to an earlier question, there is some work underway, commissioned by the Scottish Government and Public Health Scotland with Capgemini, looking at modelling, looking at scenario planning. So there is work underway, and there's a number of tools being developed. As soon as we have something that we can share more publicly, we'll bring something back to the IJB. We do need to understand what their work at national level, when cut at a Lothian level and then cut further at a IJB level, gives us in the way of accurate projections. But we will bring that to a meeting of the IJB in the future.
Thank you very much for that, Paul. And now Paul White, and then I'll come to you, Tricia.
Just to close the loop, Chair, the question from Councillor McLennan and Claire's response to that covered the point I was going to make. So quite happy with that response. Thank you.
That's great. Thank you very much. Tricia.
Just a comment to support the care home team expansion, but also to be aware of increasing care at home, and where does the budget come for that? And the announcement today that England is increasing its funding for care homes, and I wondered if Scotland was going to get a share of that.
Okay, you've really got your finger on the pulse. That hasn't been one of the alerts that's come through on my phone yet today.
Yeah, I wasn't actually even aware of that, Tricia, so I don't. I would need to follow up in terms of if there was any consequentials that flow through to Scotland regarding care homes. And in terms of care at home, that is something that when the remobilisation plan did go in through the health board, we do reference care at home and the likely impact that remobilisation might have on that. It's not one of the ones that we have actively pressed the button on so far.
And also just, of course, the social care sustainability payments as well, as those start to taper off. And a reminder to anyone that I think it's the end of October that any applications have to be in if for any of our providers who have had additional COVID-related costs. Ian, your hand is still up. Do you want to speak or?
It was just to reflect that I think Tricia's made a very valid point there about care at home, and there are a range of challenges for those providers, and more so if we start to see again periods of local lockdown, because I think we have a vulnerable community who experienced a lockdown for a period of time, so to go into it a second and a third time will become increasingly challenging. There have been some initial documentation shared from Scottish Government around plans for the supporting people group that's been mobilised during the COVID period, and I think we'll be looking at the shielding population, but also supporting people within the community. So we can hopefully, that was just shared on Friday, we can hopefully share some more detail on that as it progresses in the coming months.
That's very reassuring. I'm going to take one. Oh, Councillor McMillan's hand has gone down, which is actually helpful because I am conscious of time and we still have some items that are going to require, I think, quite a bit of discussion. Again, we have no recommendations which require a roll call. So are members happy if we can maybe just acknowledge that if they're in agreement with the recommendations?
Agreed.
Thank you very much. Fiona, next item, please.
Thank you. The next item is East Lothian IJB directions for 2020-21.
I'm going to speak to this, Chair, if that's okay. My name is Claire Goodwin. I'm Assistant Strategic Programme Manager at the East Lothian Health and Social Care Partnership. I'll go very briefly through the cover report that Paul Curry prepared. It provides a bit of a background to development and review of directions and includes the strategic basis for directions and highlights recent guidance that was published in January. I should say that we had a IJB development session on the 20th of August, where there was full discussion of the current directions and discussion about potential changes and review to them. That's described briefly in the cover report. So there's some initial contact with change boards and change board chair. Their recommendations then came to that development session that I just mentioned. We developed a set of recommendations thereafter, and again had further consultation with the chairs of the change boards. There's a draft set of directions contained Appendix 1, which I don't suggest we go through in full detail, but we can come to in a moment. And before we go on to do that, I think it's also worth noting that at the development session, we had discussion about a number of other directions that are likely to be necessary in the coming years. So things that were discussed were reprovisioning, but also some of developments in housing and so on. There was also a keenness to look at potential directions to capture some of the innovation and improvements in service deliveries brought about by COVID. So that's something that's very much been kept in mind. So if it's okay if we move on to that appendix with the draft directions. There's 22 of the directions that are going to be continued, or we're recommending could be continued. There's 15 directions that there's recommendations for revisions to, and there's 5 directions that we're recommending be retired, either because they're no longer relevant or because they've been completed.
Thank you very much, Claire. That's the echo gone now. That's great. Thank you for muting. I wonder if I could just start. So first of all, on DO1H, it talks about monitoring services, and I just wonder, is that about seeking feedback from service users? I wasn't quite sure what that term referred to.
In this context, for monitoring services, it's and perhaps Lorraine can clarify, but my understanding is it's in relation to patients during COVID going to the local community hospital for monitoring of certain long-term conditions.
Right. Thank you I wasn't sure if it was services which monitored or we were monitoring the services, so that makes that clearer. On DO2I, I would just be really keen to, I know we could add to these forever, but to see the word outcomes included in that. So that's adults with complex needs. So unless that is going to be part of the kind of the assessment and care packages which are going to flow, but we do want that work to be very much outcomes focused. I wanted to welcome in DO2K in terms of mental health officers. I mean, it's been a challenge across Scotland and one which is constantly raised at COSWA, and also to welcome the direction around self-directed support. It's really good to see that highlighted in that way in our directions. And in D18B to see the inclusion of older people with complex needs, that it's a great thing that people are living longer, but to ensure that we have services for older people which meet their needs. And the final thing I wanted to ask was, so rather than comment, in terms of hosted services, so if there are hosted services like dental services, and if there's a new direction which relates perhaps to COVID in the way that we have a direction for primary care, would the IJB have sight of that direction or for any other hosted service? I've got lots of hands up. I don't know which one is to answer that question. Is it clear? Around hosted
Sorry,
services?
I'm afraid I can't answer that one. Perhaps Paul or Ian may be able to answer that.
Paul or Ian, or it can come back at Ian. Thanks for having a go. And if it's not possible today, but I'm just aware that our hosted services will be impacted as well.
No, apologies, Fiona. I just don't know the answer to the question, and if possible, I might just need to come back to you with a response to it.
That's absolutely fine. Can I now take Paul McLennan, and then I've got Paul White and Lorraine also wanting to come in. So I'll take Paul, the two Pauls with their questions first, and then maybe across the officers, they may actually find themselves responding to more than one question. We'll see if that works. Paul White?
Yeah. Thanks, Fiona. Just I suppose just for clarification, and again, just because we're coming to this meeting, this is maybe been discussed before. D12, it talks about transforming care for older people, and it talks about transforming services, mentions Eddington and Belhaven and so on. And Claire mentioned about reprovision as well. Is that the same work stream, if you like? And I'm just looking for clarity on that. Is that the same work stream, or is reprovision going to be a separate work stream to what we're looking at here? Because as you know, Fiona, we've had these discussions about where we go from this. So just for clarity for myself, is that continuing, or is it a reprovision, a new work stream?
No, that's continuing, and I think we were keen to get language right in this, Paul, and reprovision kind of sounds like you're going to maybe replace like with like, and that's very much not what the transformation project is about. So I think there was a change in terminology rather than a piece of work dropping off. So that work is continuing.
Good. No, thanks for that.
Okay, Paul White, do you have a question?
Thank you. Page 93, direction D18A. I notice a continuing direction, so apologies, this has been well covered previously. But under the Learning Disability Housing Strategy implementation, there's a note about reducing exposure to standalone single tenancies and also to developing core and cluster housing. So two questions. One is, what do we mean by exposure? And the second is, have we consulted people with learning disabilities about their housing preferences?
It's a really good question, Paul. And I think often language like that, exposure, it's like high tariff care packages. It kind of grates, doesn't it? and I'm sure through the reference group there maybe would be some work around that, but is there someone who's able to respond to Paul's question? I think you might physically need to wave to me. Or speak up then, who would be able to respond in terms of that direction and the work of that change board?
Ronan answer that.
Thank you. Go ahead.
Hello, Chair. It's Ronan Laskowski here.
Hear me? We can, Rona. Go ahead.
Lovely.
Sorry, I didn't see your hand up.
The learning disability strategy has been developed through consultation with a stakeholder group, which has carer representation, user representation, and third sector representation. The exposure is a number of things, predominantly workforce availability and also overnight support. To have standalone single tenancies where there's 24-hour support and supervision required is not something that's sustainable across the county. Once the needs of people with complex needs was reflected in the local housing strategy, and we started over the last year to 18 months to be in receipt of allocations of housing in a more congregated manner. It's allowing us to begin to rethink our provision, but allocation and the acceptance of allocation is down to individuals and their families. So whilst there is a financial element to it, it doesn't move us away from personal choice and personal outcomes. Fiona, I'm sorry, I can't hear you.
And that's because I haven't put my microphone back on. Apologies. Paul, is that something you maybe want to be in touch with Rona about if you feel there's something you could contribute to that work?
Yes, absolutely. Thanks for your response, Rona. That was helpful. Thank you.
Okay then. And Lorraine Cowan, you've been waiting very. Oh, and your hand's gone now. Paul, are you wanting to come back in? No, it's Peter Murray. Same initials. I'm playing IJB member bingo just now. Okay, Peter, would you like to ask your question?
Yeah, thanks, Fiona. I suppose it's two comments really. One is around the smart objectives that we might see emerge from the directions that we're agreeing today, and that would probably bring some consistency to our ability to not necessarily monitor them in that operational detail, but at least be reassured that a smart principle has been applied to each and every one of them. And the second is on reprovisioning, and I suppose it's an impossible question to answer, so I'll make it a comment that whilst we have a national review of adult social care, I think it's probably worthy that we would find the opportunity to inject any perspective we have on what reprovisioning means in East Lothian, because unless we do that, we may be seduced into a single model that is not necessarily the model that I think we were hoping to allow transformation to properly consider.
And of course, post-COVID, that may look very different from the way we were thinking before. I just see John McMillan's hand up. I'm going to make this the last question or comment in this session, because we have spent quite a bit of time on this in the development session, and I'm keen that we make some progress through the agenda. Okay, John?
Yeah, quick as I can. I think this is a fascinating paper. As an outsider, I think it would be worth, and I'm happy to take this offline, it would be worth a briefing to other members of the council around the process, the development process, and the actual directions. And I echo Peter's comments about smart measurement and objective setting. It came to me as something new. I think it really describes your aims and goals and your desires and your values, and it's something I would like to explore further. And I wonder if it might be the subject of a briefing to all members around setting the work of the IJB in context. So I appreciate the time spent on it. I don't want to spend any more, but I would like to hear more about it. So thank you.
That's an excellent proposal, John. Okay, then we're now going to move. So because we have recommendations for approval at item 1 and 2, Fiona is going to take us through a roll call again.
Thank you, Chair. Yes. If I can ask, when I read out members' name, if they could please indicate whether they approve the recommendations as set out in the report. Fiona O'Donnell.
Approve.
John McMillan.
Approve.
Paul McLennan.
Approve.
Susan Kempson.
Approve.
Patricia Donald.
Approve.
Fiona Ireland.
Approve.
Peter Murray.
Approve.
Thank you very much. That's confirmation that the recommendations were unanimously approved. And we can now move on to item 6 on the agenda, which is redesign of urgent care, implementing the national model in Lothian.
And can I just say again, this, in terms of this paper, members will have read it. So if the comments could be kept brief, thank you.
And Fiona, I'll be speaking to this. Paul Curry, Interim General Manager, Strategic Integration. The work that's described in the SBAR paper and the 2-page addendum reflects on work that's happening at national level as part of a review of adult urgent care. There are 2 things that's trying to deliver. It's wanting to have better management and scheduling of people who are patients and clients who present to the emergency department and to local board services, and it's trying to find a way to reduce self-presenters to emergency departments, also known as A&E, because often they arrive at A&E and it's not the best place to be. They should perhaps be elsewhere. So this piece of work is as a result of an awareness, and it's been in place for many months, if not years, that the activity keeps growing in A&E and people's resolution of their needs isn't necessarily very well achieved through the A&E arrangements. The paper gives you a bit of background, looking at the fact that we have had an unscheduled care programme board. It's chaired by Alistair Short, one of the IJB chief officers, and the 4 chief officers for the IJBs are represented on that, including our own chief officer, Alison MacDonald. We know because of COVID that there are even more pressures on the services, including the need to protect our patients, the wider public and staff, by utilising our services efficiently and not cramming them into the acute hospital. And I heard an A&E colleague from England describing how A&E has elastic walls. In effect, you can just keep pushing people into it and they just keep stacking themselves up like sardines. We can't now do that. We have to find ways in which there's going to be a different arrangement, and this is described in the background paper. And interestingly, that's been reflected in some pilot work in England as well. There's going to be a new pathway for urgent care, which will use the established NHS 24 111 telephone number, which, as members will understand, is designed for non-urgent inquiries. The 999 service remains there for those people who are seriously injured or seriously unwell, and that will continue to be the case. The paper sets out where the current provision is in terms of minor injury units and emergency departments. And of course, our nearest is the Royal Infirmary of Edinburgh for those patients who live in East Lothian. The intention of trying to develop this pathway is to smooth demand. And again, there is an interesting phenomenon where there are certain times of the week when people are rammed into A&E, often at weekends because of alcohol and the after hours behaviours of people who've had a few too many. But there's also other times through the week when there's peaks and troughs, and that's inefficient in terms of when we allocate our expert resources for people who need the expert care and how we send people to other better places, either in hours or out of hours. And as the paper reflects, we will continue to have an out of hours service, Lothian unscheduled care service, and we will still have COVID community pathways as and when they're required in order to ensure that we are streaming people in the right places. It's worth noting the last sentence of the background section, that is going to be delivered through a 24/7 Lothian Flow Centre, which will take all of the NHS 24 referrals that are appropriate for further disposal and will schedule either virtual or face-to-face appointments to services within Lothian. And they could be emergency services, they could be something next door, but they will be more managed and aim to rather better meet the needs of people who've been assessed by a clinician. It's worth noting that the estimate is that 20% of people who go to A&E, to the emergency department, could receive that care at home or closer to home. That's a fair number of people. And it's also worth noting that our GP colleagues have most of the contacts with patients, something like 94 or 95% of health service contacts go through GPs, and we can't really afford to give them more to do. So we're not looking to send this demand back into primary care. We're looking to have a different arrangement. Members will be aware that we've got our quick service, which follows some similar themes to what's being proposed at a board-wide, Scotland-wide level. And that has had some good outcomes in terms of redirecting care from GPs. So in closing, there are recommendations asking for the IJB to note the work that's ahead and to agree to receive regular updates as and when we have them. The work is being done at a Lothian level, but we are, as I said, fairly well plugged into that. So we will receive regular updates, which we can then pass back to IJB members for comment and suggestions. Thank you.
Thank you, Paul. And I do have a number, I think, of anxieties around what's in this paper. First, on the timescale and recruiting staff, creating that priority, anxiety around the capacity within NHS 24, given our experience locally with the introduction and the rollout of the quick service. And I was reassured about what you said about GPs, but the paper does talk about GPs being the most appropriate people for urgent care. So just wondering if, I think people, if they can't get to ED, are going to want to see a doctor, and it's going to be really difficult. I wanted to ask, so I hope someone's taken a couple of notes here about North Berwick's minor injuries. Is that service kind of not being offered just now during the restrictions, or could that be part of the capacity building? There's mention on page 99 at point 6 of a local hub, and I wondered what the proposal is, if that's been worked through at all for East Lothian. And finally, I think the biggest challenge in all of this is going to be around communication. We have a very short time frame, and the Scottish Government has to get this message out to patients. And I think how long it's taken in Musselburgh and Portseaton and other places, and that's my biggest concern, is getting that message out to people. On the one hand, if you need to go, you must go, but you need to work out whether or not I just think it's going to be quite a subtle message, and there are risks within that. So apologies for the length of it. My list of questions and anxieties.
Would you like me to return on some of those points, Fiona?
If I could come in for a few of those, Fiona, if
That would be great. And if not, I'm happy just that I put them down on record, because then that'll be something for me when we're getting updates for me kind of think, right, where did we get to with that? Thank you, Ian.
So I think firstly on your question of the most appropriate place for these patients to return to is the GP is probably a bit simplistic, and just sort of initial thought for what's been discussed. And I will say that I'm aware there are more national conversations with the LMC about the implications of any amount of secondary care work that would then be, and even if it's inappropriately been in secondary care, it has been going to secondary care, it has been resourced in secondary care. If it's to return to primary care, it's an additionality, and resource would be required to support it. Having said all that, I think we in East Lothian are potentially very well placed, given our multidisciplinary services that are already based within our community through the work we've done through both the Primary Care Improvement Plan and through other expansions of services to support primary care. So the first phase for the 31st of October will see the attempt to schedule people who are attending at A&E, and this is primarily about, yesterday they were around about 400 attendances at A&E. That's a huge number of people to be in a building, and it is unsustainable once we get into winter pressures for those sheer number of people. So those who can access secondary care through a booked service should do so safely. So that's the primary driver. The first meeting, in answer to your question about both North Berwick and local hubs, the first meetings will take place next week about the second phase of work and how all partnerships work together with the Flow Centre to bring some of that work back to primary care. So we need to explore how much of that would necessarily come back to an appropriate service that might be centralised or might be East Lothian based, and we still need to work through all of that in terms of operational detail. From our perspective, though, as said, we've got resources, both you've highlighted North Berwick there, and through our quick teams and through some of our others, to potentially, I would say, expand those services to take on this work rather than try to absorb it within the existing models.
Thank you very much for that.
If I missed any, happy to come back.
Great, thank you. That was really helpful. And just an encouragement, please, to make sure that when these messages are coming out, they're circulated to councillors, that local social media platforms that we can put them onto. You know, there's a PANS folk or a Dunbar folk in every community in East Lothian. That's a really good way, as we've seen with Protect Scotland, to get people the message across. Fiona Ireland and then Paul McLennan.
Thanks, Fiona. I'm a bit reassured actually by what Ian's just said about further conversations around local solutions, because my concern, and I think I have raised this previously, is that as an IJB we have developed a lot of community local based services, and I'm very concerned that actually putting in this national layer of communication is actually going to further confuse people rather than make it easier. But I also think there's something about looking at the pathways. The pathway needs to be as smooth as possible, and for some of the services we already have, it feels to me that what we're doing is actually putting in an additional step, and I think if we can smooth that one out in the future meetings, that would also be very helpful.
That's such a good point, Fiona. You think our MSK line and the success of that, saying to people, this is where to go if you've got musculoskeletal problems, and being able to refer direct to mental health services, it does kind of take us in another direction of flow. Paul McLennan.
Thanks, Fiona. Two points, I think, for me. One was around about, you mentioned, Fiona, around about communications. And I think what I'd like to see for coming back for the next paper would almost be like a communications plan tied to this, because I think this is fundamental. You know, there's a communications, and I'm not talking about a huge big piece of work, but there needs to be a communication plans tied to this, because if we don't get the communications right, it isn't going to work. So I would ask if that would be brought back. The second thing as well is around about the metrics for it, because what would be interesting, it's not, East Lothian have 6 or 7 distinctive communities. It would be good if we get metrics beyond this to see kind of what the take-up is within all the areas, because it might be easier, for example, to do this in Musselburgh or Trinent than it would be in Dunbar. So I think I think we need to look at the metrics and trying to break that down into ward areas, because I think you might see disparities around about from the 6 wards. So I would ask for a communications plan, and when we do get metrics, that it's broken down at each ward, so we can actually measure how effective that's been, not on an East Lothian basis only, but on a ward basis, so we make sure if we need to nuance our approach, we can do that, and we've got evidence to do that with.
I think that's a really strong point, Paul, that, you know, and why I'm passionate about us designing solutions in our own communities, and certainly hope a national care service is not going to be taking away from that, which I know is something we both share, that aspiration, but I think that flexibility we have locally is really, really important. Ian, did you want to make respond in some way to Paul?
Just to really acknowledge Paul's point about data as an exceptionally important one, and I guess back to that point I made about that some of this work being appropriate at GPs, I think there would be a view that one of the reasons that people inappropriately or potentially inappropriately attend A&E is because they can't access services locally, or they feel that they can't access services locally. So if you have a GP practice which is struggling to meet the demand of that community, and so that's the population that's attending A&E, redirecting that back to an already busy practice is not a solution. So I think it's a really important point that actually we need to get this information out, and we've asked for this as part of the operational rundown, is where are people attending A&E from, and with what types of conditions, and can we understand that so that we can develop those local solutions? But my big worry would be, and I don't think this will happen, but my worry would be redirecting the people who are already vulnerable, who are already struggling to access primary care services, back to those services again just creates a loop that's unhelpful for everybody. So I think I just really wanted to re-emphasise Paul's points as very good ones, and we will do our best to bring back more concise data on this.
Absolutely, and of course there'll be national messaging as well. Hopefully prime time television, which will also catch people. But yeah, certainly, particularly people with alcohol and drug issues, it's just really important that the support is available to them. So I'm going to bring in John Turville first, and then Tricia, and I'll take the two of you immediately after each other, and then if there are any responses. So, John.
This is both very interesting and very concerning, and a lot of the comments that have already been made by Paul, by you, Fiona, and by Ian, I've covered some of that. But speaking as a GP and having some connections with the National Primary Care Leads Forum, I have to say there's a lot of anxiety about this in primary care for all sorts of reasons. And I think the motivation behind this initiative is understandable and laudable, in that I think the government has seen the success of the COVID pathway with 111, the phone assessment centres and the community assessment centres diverting COVID work away from GP practices. And they've also seen an opportunity to build a similar model to quite rightly try and reduce walk-ups to A&E and reduce crowding. The trouble is, I think, that only one part of the system that's being addressed. They talk about the front door. The front door to the NHS is primary care. A&E is a much smaller front door, but as Paul said, 95% of urgent activity in the NHS goes through primary care. So there's a big risk of displacement. And as Ian said, displacing work back to highly pressurized practices, particularly in the west of the county, which are on their knees, many of them. And notwithstanding the fact that we've built our support services, our QUICs and our CTACs and things, and they're coming along very nicely, if work that would have previously gone to A&E floods into them instead of being in support so much of GP practices, then that in itself is a concern. So I think there are a lot of risks in it. There are some benefits too, and in primary care, obviously, there's just a worry that it's the risk of activity flowing from secondary care to primary care without the resource that needs to go with it.
Thank you very much, Sean. I agree. I'm not certain this is the right solution to this problem. And when you see in the health board already that we're struggling to make our 4-hour waiting time target in ED, and that's before we're anywhere near the levels of demand reaching normal, then I mean it all just seems such a complex problem to address. Tricia.
Yes, I agree. It's very complex. I think to perhaps put a more positive spin on this is that it shows an amazing collaborative approach to try to schedule unscheduled care. And I really commend Jenny Long's work to bring everybody together and to listen to all aspects of this care. I'm sure that one of the biggest challenges is primary care, for John's points. But I think it is an attempt to have a whole system approach, and we should welcome that. I think there's a lot of learning from the COVID Hub, and the COVID Hub is moving completely on the 11th of October to join the Flow Centre. So you've got a lot of experienced triagers who will be helping to redirect. But you're right, it's about where they redirect to. And on communication today, I've obviously just been listening to the news a wee bit today. There was a big announcement from England about using the 111 to access advice. And I think we need to think, how does East Lothian link with Lothian to link with Scotland to get key messages out, so that there's clarity and not confusion about which pathway when and who to phone for what. So lots of warnings, but I just do think it's been a great opportunity for everyone to at least come around the table and try and look at the problems to find new solutions.
Thank you, Trisha. I really hope that turns out to be the case, and I think we need to monitor the impact on health inequalities as well. We've seen with advice services in East Lothian having to operate differently. Many people will have gone online, but there'll be a group of people who still like to turn up at their local office and actually see someone, and those are often the most disadvantaged people in our community. John, did you want to come back in for a final comment?
Just another brief comment. I don't want to be a naysayer, but a lot of those experienced triages in the COVID pathway have been GPs. There's considerable pressure on our out-of-hours services. They also are at risk of failing right across Scotland. And it's the same cadre of people doing this work. And you can't use a resource more than once at the same time. So the concern is that the people who you need to do the triaging, that give the clinical support in the flow centres, will pull folk away from other parts of primary care and cause weaknesses elsewhere. So we do need to watch for unintended consequences. But I do agree with Tricia that it's a bold initiative. I mean, ironically, we in East Lothian have had a go at this already, haven't we? And the government's input to it was to pause it because of concerns, and also when NHS 24 were pulled away to do the COVID pathway, we lost it. So it's ironic.
Right. Okay, thank you very much. I'm just very much aware of time, so I'm now going to move. We don't need, again, a roll call vote, and so to ask if members are happy to approve the recommendations for noting in this report.
Approved.
Great, thank you very much, and we look forward to the updates. Fiona, next item.
Thank you. Item 7 is winter planning.
Ian.
And I think that's me. Ian, do you want to speak to it, or?
No, Paul, you can take us through, but I'll be happy to take any questions afterwards.
Yeah. Ian's my ask a friend if I get stuck for any answers to any tricky questions. The paper, again, it's an SPAR summary paper with an appended paper in further detail. It sets out the situation we currently are in regarding our planning for the winter ahead. Of course, this year's winter is somewhat different from last year's winter because we have the spectre of COVID visiting us. The things that would be difficult enough to achieve in normal winters will be more difficult this year. We have had successes in previous years, however, in developing a range of local actions to intervene in order to change the profile of demand and to meet that demand as it presents. The other thing to mention in this year, of course, is that we have a scaled up flu vaccination programme. In most years, we do have a vaccination programme, and that's for particular categories of citizens. This year, that has been expanded, and it will, if there's enough vaccination, include those 50 years and above with no other health conditions. But that's a matter that's really about supply and demand on the flu programme. The background lets you know a little bit about the routine plans to try and present a resilient service to cope with demand, and it reflects on the fact that we have used our local teams and resources to support people at home, to prevent them from presenting inappropriately, and to assist those who are medically ready to come back home to be supported in coming back home. There is some financial investment that accompanies a winter plan, and that's been secured again this year. So in summary, the 4 categories I've got in the paper are investments in enhanced discharge to assess, and that's a rehabilitation input to support discharge and to prevent admission. And it has had some great successes as described in the paper. And it does look at dealing with particular client groups who are at particular risk. Good example being those people who are elderly and frail, and those people who've got chronic obstructive pulmonary disease, which doesn't do very well over the winter months. There's a plan to expand the patient flow team to 7-day working. And I should reflect on the fact that some of what we're talking about here does chime with some of the plans that were described in the last paper. This isn't an only for East Lothian development. It has to plug into the other parts of the service as well to ensure that we properly utilise resources that are available at Lothian level. We've got investment increasing the hospital to home capacity to ensure that those people who are medically ready for discharge have the right care at home and are helped to get back to the level of functioning that is appropriate to them, to try and perhaps reduce some of the deterioration that may be in the result of a stay in an acute ward, which maybe fosters dependence. There's also an investment in extra home care services. Again, this is about maintaining people at home to ensure that we can provide the right tailored packages of care for our citizens, and through that to reduce the number of people who are within the acute setting. So there's 4 broad categories of activity. They are interrelated. They are about finding ways to intervene early to prevent admission and to get back into the hospital early in order to encourage and accelerate appropriate discharge. The recommendations are asking the IJB to note a number of things that are underway, to note the planned service development and delivery arrangements, to note that we have a flu programme established and there's more information about that appended to the paper. Note that winter doesn't come alone this year, that we also have the COVID-19 situation and the possibility of further peaks of that over the next few months, and ask the IJB to note that links from this work are in place with the unscheduled care work that I described, and to the Lothian remobilisation plan, which is trying to manage the stepping back up of services, both scheduled and other services, diagnostic and such services, in order to start to do something about the backlog of patients who require care.
Okay, thank you very much for that, Paul. I just thought what I like about the recommendations is that these are tried and tested in East Lothian. We know that we work, and it's about building that capacity to ensure people get care as close to home as possible. I just had one question, which was kind of around the uptake of the flu vaccine, and I'm wondering from the cohort who got it last year if there are concerns that people are going to be wary of going to their GP to get their vaccine. I've had an elderly neighbour phone me today saying, I've been told I've got to wear a short sleeve top and put my arm through the window to get my jab, and I'm not doing that. What was it? It's raining. And so I'm just wondering if we are going to monitor whether or not there's a drop off in the take up amongst older people who previously received the vaccine.
I could possibly answer that, Fiona. I think our anticipation is that we're going to get increased uptake overall. Uptake in the over 65s has always been high, sort of 75%. Uptake in the risk groups below 65 is lower, 40 to 50%. We want to get that up, but we're anticipating that COVID will drive up demand. Yes, there are some apprehensions about attending primary care settings, and we're obviously doing our best to reduce risk, but we are seeing people face to face quite a bit in primary care now where it's necessary, and I think anxieties are reducing there, and the COVID pathway has obviously helped to reduce risk in GP premises. In terms of how practices are being pragmatic about how to reduce the risk, yes, people are being asked to to have their arms bare and available to make it it slows things down if people have to disrobe gradually, but we don't expect them not to have a coat on. And they're welcome to bring an umbrella. You may have heard that at the harbours we are actually immunising people outside the building in the fresh air. Yes, there are some weather challenges with that, but there's a huge reduction in risk compared with flowing a large number of people over a short period of time through a building. So there's all sorts of innovation going on, and we are expecting the uptake to be greater, particularly if we do get to doing the 55 to 65s once the others are done, and then the 50 to 55s. But there's a little bit of concern that by the time we get to December and beyond, we may be beginning, hopefully, a COVID immunisation campaign. So those are going to overlap.
Yeah, thank you. And I think it's an excellent initiative at the harbours, and especially on a glorious day like today, John. So, and I think the message to be now as an over 60 myself, I've booked mine at my local pharmacy, and they're doing that in the lunch break in Port Seaton to limit the contact with customers. So just to encourage everyone, the first time ever I'm having my flu vaccine, but to do what you can to keep yourself and others well and protect the NHS. Are there any other questions on this paper? I know, Paul, you were offering to add more, but I'm just really keen we advance. Because
I've got one small point, Fiona, if I may, and it's really just to emphasise that this isn't just about the public. We're also seeking to vaccinate our staff colleagues in order to make sure that they are available for work and that they stay well. So that's a very important part of it. And I don't know if anybody knows the figures for staff attainment for vaccination, but I would imagine it will be greatly increased along with the numbers for patients.
Yeah, and I'm sure NHS
certainly should be. It certainly should be. We should be 100%. We've not been great in past years at getting staff immunised, and we can do better.
And that will really help in environments like schools in terms of limiting, if staff there are getting it and avoiding any further risk to their and their students' health. Okay, thank you very much for that. Again, we don't need a roll call vote, so are members happy to approve the recommendations? Okay. Thank you very much, and thank you, Paul. Now, Ian, you have your verbal report, which you were keen that the IJB received today, and I believe you will be circulating papers relating to this at a later date, but just the feeling was it was really important that we didn't wait till the next full business meeting to get this update. Okay, Ian.
That's correct. Thanks, Fiona. So this is a verbal update on the work of the Primary Care Improvement Plan, and I felt it was urgent that we got an opportunity for us to discuss it, and I will, as I said, as you rightly point out, circulate an update paper after the meeting. The reason for concern was really that due to COVID and through the lockdown process, some of our services had to be altered, and since July we've been working hard to remobilise as many of the services we can. So the Primary Care Improvement Plan, just for those who are unaware, requires us to take forward a range of key services in order to support general practice. And I suppose with a sort of simplistic view of trying to take activity away from GPs where appropriate, so that they can focus on being the general medical expert. The areas that we should be focusing on under the GMS contract MOU are pharmacotherapy, vaccination transformation, additional professional roles, the Community Treatment and Access Centre, the Community Linked Workers Project, and urgent care services. So with any slowing, the progress on this is going well, and at this point in time there's a number of these services which are, as of today, available to all practices or as direct referral from the public, so able to phone in themselves. So at this point in time, the under additional professional roles, the two that are recommended under the GMS contract MOU statement for service development are musculoskeletal services, often called MSK services, and community mental health services. And within East Lothian, both of those are now available as open access services for direct referral, for direct access from the public, or through GP referral to the services. So we now have a level where those are, we're still keen to progress those services and increase the capacity within them, but they are available to everyone within the public. Under the pharmacotherapy programme, there were 3 levels of pharmacotherapy that we were looking to develop, each one representing an additional level of complexity. And we currently have a position where, again, all practices within East Lothian have access to some level of pharmacotherapy, with the level of complexity and support they're receiving dependent on a joint assessment with the practice and our pharmacotherapy lead, Alan Malarvey, looking at what they could benefit from, along with what we were able to recruit to and sustain in the longer term. The community treatment and access centres, which are designed to take on more basic's the wrong term, but straightforward procedures currently done in GP practices, such as chronic disease monitoring, dressings, phlebotomy, suture removal, are currently available in a range of practices across East Lothian. So there are centres, if you like, hubs in East Lothian Community Hospital with satellite provision in a range of different practices, and a second hub in the Musselburgh Primary Care Centre. So there are satellite services in Trinent and in Preston Pans, and an intention to develop this out to Dunbar. And we're hopeful, based on recent recruitment, that by December of this year, all practices across East Lothian would have access to the community treatment and access centre services. The vaccination transformation programme is a little more complex because of flu. The paper, I'll not go over it in detail because the paper was circulated as part of the previous item detailing everything that's been done around the flu programme, but we are in a fairly strong position this year to offer genuine support with the delivery of the flu programme. So we will focus on the under 65s at risk, but we'll expand out for opportunistic vaccines, and we'll do more if we can. And the community links workers service, the second to last, is currently was currently in place around a few practices, but required to be re-tendered. So the tender is currently closed this week, and I'm unable to share too much detail on that, but will be reviewed, and we're very hopeful that all practices will start to receive their services under the Community Link Workers Programme by the end of the year, but hopefully boots on the ground sometime around October in at least some of the practices across East Lothian. So finally, the support around urgent care, which most people would recognise as a quick service, was one of the most affected by the apologies, is somebody on mute? Ask everyone to mute. I'm getting a lot of background noise. If I mute all participants with that, please don't think me rude.
If you can mute us all, do it, Ian, because it was getting worse.
Thank you. I promise that's not just because I like the sound of my own voice only. So the final area around urgent care was what we would recognise as the quick service. So that is currently available to Riverside Medical Practice and Harbours Medical Practice as refer-in. So we don't have a direct access service model for that yet. I think it would be a direction we'd like to head in, given our learning from MSK and from community mental health. We are working to hopefully go live in both Trinent and Inveresk during the month of October. We've again recruited additional members of staff. I should mention that has had to change from what a lot of the members of the IJB would recognise as previously the same-day access service that offered face-to-face appointments, and actually because of COVID is now offering a high volume of phone appointments. But given the previous challenges that we had around transport from your practice, it's actually potentially a benefit that we're able to deal with and manage a range of appointments and inquiries over the phone. At the moment, it would seem to be around about 70% of what's sent to Quick can be managed over the phone. And so far, members of the public who've had to travel to Musselburgh Primary Care Centre seem to be doing so and are quite happy to do so. So that will hopefully be live in Inveresk and Trinent around at some point in October, and we've recently had inquiries from Preston Pans, and we'll be looking to expand that out. So as the service develops, again, we would be keen that there would be a direct access version of this available, but it would probably be the one where we've got the most significant amount of work to do in order to achieve our operational delivery of having it available to the whole region in over 2021. So apologies, because I've talked a lot there, and I will share a paper that details that and has a diagram setting out clearly where we've put these services into practices and where we're still in development to do so. But I just felt with the it would have been very challenging to have had a paper put together in time for the IJB today, but I felt it was an important matter to discuss. So I'm very happy to take questions now. I'm also happy once I circulate the paper, which I would hope to do early next week, to take any direct questions after I've done that. So thank you very much for your time. I would also recommend that there might be a view taken to bring a further update on this in 3 months' time. So thank you for giving me the opportunity to bring that update, and apologies again that there's not a paper shared at present.
Oh, I still think it was important, Ian, that we had that, and thank you for that. And I'm going to suggest that we maybe wait till we see the paper in front of us, because I think that will give a better to sort of have that whole overview of what's in it. I think the mix that we have here of a geographically specific service, but then clinically specific services as well. And I think that blend that is working well, but we need to keep monitoring it. So are members happy just to note the content of Ian's verbal report?
Yes, thank you.
Thank you very much. Okay, Fiona, do you want to make the statement in terms of us moving into the private session now?
Yes, thank you, Chair. That concludes all of the public business for the Integration Joint Board meeting today. We have one item that you've resolved to consider in private, so now we would move to private session, which means that the recording will be stopped, and I would ask if there's any member of the press present in the meeting just now, ask them to leave the meeting now, please.
I'm also